In a situation like this, information and outreach are critical, but just as important is stamping out misinformation and scapegoating. My colleagues will share with you what the Assembly is doing to share information and resources.
First, I wanted to start by putting some context in where we are today. As you know, California was the first state in the United States to identify the H1N1 virus, which has been referred previously as swine flu. On April 17, the CDC determined that 2 California cases were indeed a unique combination of gene segments that have previously not been recognized in the United States or elsewhere in the world. These cases occurred in San Diego and Imperial counties, about 130 miles apart, and were not related to each other at all. They had no swine contact, and they had no travel history to Mexico. Currently, in California, we have a total of 159 cases as of this morning. Please remember that these numbers change, and this afternoon we'll provide updated figures. Now, it's important to note that I mentioned 159 cases, and that is because more and more we want all of you to understand that total cases, whether they're probable cases or confirmed cases, give us a much better measure of the epidemic. We have, in working with the CDC, identified that of all probable cases that we've had since we started, about 97% end up being confirmed cases. So it's pretty safe to assume that all cases, or the great majority, are going to be cases. So of those 159 total cases that we have, 29 have been confirmed by laboratory, and 130 are considered probable cases. Now, while the initial cases were limited to the border, as I mentioned, it's important to know that cases now occur in 22 California counties. It is also important to note that most of the cases in California do not have a connection to Mexico, either through contact or through travel. And our recommendation on hygiene and our recommendations on staying home when you're sick apply to all residents of California, regardless of background, race, and ethnicity. The World Health Organization, as you know, raised the pandemic level to 5 last week. We hear that there might be a possibility that that pandemic might be raised to level 6 this week. And I wanted to provide some context of what that might mean if you hear about it. A pandemic level basically tells you where the virus has been seen around the world. It is not a measure of severity, which is really what dictates our actions. So when this becomes level 6, if it ever does, just basically means that this is widespread throughout the world. And it has no impact really on how we handle the epidemic. In California, we have been prepared. We have been doing this from the onset. We've had an aggressive response. And independently of the pandemic level, we are prepared and we're doing the right thing. Now, I just wanted to close by saying that California is very prepared for this. We have received significant resources in the past to address this problem. We have a plan in place that has been tested on multiple occasions. And we have worked with our local partners consistently in planning precisely for this event. And what I'd like to say in this situation is that we have planned for the worst case scenario, and we're hoping for the best case scenario. As you know, we are currently seeing very mild disease in California. Out of all of the cases that I presented to you, only 8 have been ever hospitalized, which I think is very good news. And we have had no fatalities. So we continue to see mild disease, most of these cases resolved without medical intervention, which speaks very well for the future now. We need to remember that we are very early on in this epidemic and that the virus is changing and might change more. And so we need to not be led to believe that this is resolved. We need to continue to be vigilant. We need to continue to monitor. But as of today, the situation looks like it's under control and the cases continue to be mild.